Hello, my name is Lima Reyes and I'll be going over the blood pressure assessment. What you want to have your patient do is sit quietly for 5 minutes in a chair with their feet flat on the floor, with their backs fully supported, and their arms should be at heart level. You also want to make sure that your patient has refrained from any caffeine and nicotine products 30 minutes prior before the measurement. You also want to make sure while measuring the blood pressure it's taken on a bare arm, so if the patient has any sleeves, please make sure you ask them to roll them up. The next step is selecting the appropriate cuff size for an accurate measurement. There are 2 lines on the inside of the cuff. You want to make sure that the bladder of the cuff is within those 2 lines when it is wrapped around the patient's arm. If the cuff goes beyond that last line, when wrapped around the patient's arm, you want to then make sure you select a larger cuff size. If the cuff goes before that first line, you want to make sure you select a smaller cuff size. The next thing you also want to do is to align the cuff with the patient's brachial artery. There are landmarks on the outside and on the inside of the cuff that says brachial artery. With that mark, you want to align it with the patient's brachial artery, which is on the inside of the patient's arm. When applying the cuff, you want to make sure that you leave enough room on the arm for the placement of the stethoscope. You also want to make sure when applying the cuff that you do not fit it on too tightly. You just want to make it snug for the patient. When listening through the stethoscope, you want to make sure that the prongs or the earpieces of the stethoscope are facing inwards. So when you place them in your ears, they are inwards into your ear canal, so you are able to listen to the quarter cuff sounds. You also want to make sure that the stethoscope is also turned on. When placing the stethoscope, you want to make sure you place the head of the stethoscope on the brachial artery of the patient's arm. You also want to make sure that you do not place the head of the stethoscope underneath the cuff while measuring the blood pressure. When using this version of a sphygmomanometer to be able to inflate the cuff, you want to make sure that the trigger is up. To be able to deflate it, just go ahead and push down on the trigger and that will deflate the cuff. So always making sure that the trigger is up so that you're able to inflate your cuff. Now when inflating the blood pressure cuff, you want to make sure you go up to about 180 to 200 millimeters of mercury when you do not know the patient's blood pressure. So again, making sure that the trigger is up on the sphygmomanometer, you want to go ahead and quickly inflate the cuff to about 180 to 200 millimeters of mercury. Then you want to slowly press down on the trigger, releasing the air to about 2 to 5 millimeters of mercury per second. When listening, you want to hear the first thump. The first thump that you hear would be your systolic reading. As it goes, the last thump that you hear, that would be your diastolic reading. And that is how blood pressure is measured. Here is a helpful chart of some blood pressure readings to help you classify your patient. Thank you for watching my video on blood pressure assessment. Hope it was helpful. Thanks!